I really don't know what to make of this one. Well, Tony here from Immortality IMT, cryptocurrency for the longevity field. Today we have an interesting one. It's called Reversing Wrinkled Skin and Hair Loss in Mice by Restoring Mitochondrial Function. There has not been any studies that I know or experiments that I know that have been able to reverse wrinkled skin. So this should be an interesting one. 20th of July 2018. Cell Death and Disease. Nature. Interesting title. Big claim. I was thinking about this today. Red light therapy, mitochondrial function. Some other people say that the red light actually damages the skin and triggers a repair response, and that's the way that the red light therapy works. Don't know. But a big claim. Abstract. Mitochondrial DNA, mtDNA depletion is involved in mtDNA depletion syndromes, mitochondrial diseases, aging and age-associated chronic diseases, and other human pathologies. To evaluate the consequences of depletion of mtDNA in the whole animal, we created an inducible mtDNA depleter mouse expressing in the polymerase domain of PLG1 a dominant negative mutation to induce depletion of mtDNA in various tissues. These mice showed reduced mtDNA content, reduced mitochondrial gene expression, and instability of supercomplexes involved in oxidative phosphorylation, resulting in reduced OXPHOS enzymatic activities. We demonstrate the ubiquitous depletion of mtDNA in mice leads to predominant and profound effects on the skin, resulting in wrinkles and visual hair loss, with an increased number of dysfunctional hair follicles and inflammatory responses. Development of skin wrinkle was associated with the significant epidermal hyperplasia, hyperkeratosis, increased expression of matrix metalloproteinases, and decreased expression of matrix metalloproteinase inhibitor TIMP1. We also discovered markedly increased skin inflammation that appears to be a contributing factor in skin pathology. So everybody, every man and his dog is talking about inflammation. Inflammation. Inflammation causes everything. As far as I know, inflammation is a response to damage, either real or perceived, and that initiates the macrophages, the immune system, and the macrophages take care of the repair, and they call in the stem cells, and they conduct the whole repair. But with age, that system declines. It's not as robust, and so you get dysfunctional repair across the whole body, which probably leads to many pathologies. I was also looking at atherosclerosis, and they were saying that the main driver of that is inflammation as well, and that atherosclerosis itself is a dysfunctional repair associated with the decline of that repair system that we see when we cut ourselves. And the older you are and the longer it takes to heal. And the heal isn't very, the result isn't that good. A lot of fibrosis and other things. In regards, I think we're at the stage of still dealing with avoiding inflammation and getting a good response to inflammation. That is, a good repair. So then there was some argument about that inflammation wasn't the root cause, that the stimuli was the root cause. I don't even remember. You'll have to look at that girl, Patrick. What's her name? Liz. Found My Fitness. She interviews Campese and she interviews Longo, and they talk about inflammation. But they both believe that inflammation is not the root cause. Well, I kind of think that without the inflammation, there is no incident. And you'll age a lot better. Because the repair is what's declining. The ability to repair excellently is no longer there. Which brings us to another statement of the garbage theory of aging. Garbage theory of aging. According to Alexei Terman of Linköping University in Sweden, clearly, if all damaged structures were renewed with perfect accuracy, aging would not occur. But the inevitability of aging suggests that the biological mechanisms of removal and resynthesis are not perfect. Of these two processes, the one most suspect in the progression of aging is that of inefficient removal. That was the garbage catastrophe of aging and how to avoid it. So, according to Alexei, clearly, if all damaged structures were renewed with perfect accuracy, aging would not occur. Now, we know this between the difference between a repair of a child's skin versus the repair of an elderly person. The child has great accuracy in its repair, while we see in autopsy reports that repairs were not done correctly. And obviously, again, I say that thing that atherosclerosis is, after all, an imperfect repair relating to if all damaged structures were renewed with perfect accuracy, aging would not occur. If no damage occurred, those arteries would still rupture, and it would be the repair that would renew the system. So while everything you can do to avoid the damage is certainly an area of intense investigation, rupturing is inevitable, and therefore perfect repair is the only mechanism. So at some stage, damage avoidance will inevitably fail. There is nothing in our universe that is impervious to damage. Nothing. The whole design of the universe itself is encoded to change. So the renewal is the only way, or let's say the absolute minimization of damage, but then the renewal mechanism of the biology. So the two major strategies and how they relate to inflammation. Because we can study the centenarians, the supercentenarians, and try and find biological observations to explain their longevity. One of the only ones to date have been low inflammation. That's been by the Japanese group. Relate to two major strategies for low inflammation. Obviously, it's lifestyle. There are inflammatory lifestyles and low inflammatory lifestyles. There are governments that will use inflammation as a weapon. There are governments that are serious about lowering inflammation on a societal level. Damage minimization strategy or perfect repair strategies. i.e., you have a senescent cell, it infects other cells, it creates inflammation. Inflammation is a damage response. Inflammation, then, so you would have this inflammation avoidance strategy or damage avoidance strategies, whatever they are, the long list of them. In an effort, you avoid the inflammation and the immune system is not called. Whole slew of strategies there. Do an experiment. Does it avert inflammation? Does it lower inflammation? Yes, yes, yes. And you don't get inflammation to begin with. But inevitably, there will be inflammation. Inevitably. There will be a limit to the effectiveness of damage minimization, and there will be inflammation. And then you have to rely on repair strategies and perfect repair strategies. And they include things like stem cells and how robust they are and the kind of repair that they can perform, how perfect they can perform that repair. We're not talking about magic repair of damage. We're talking about the system that goes into effect when you perhaps cut yourself and the time that it takes to repair that wound and how perfect that repair was. We're talking about that system. And hopefully there are two other categories of strategy. But this is how do they relate to inflammation? Well, inflammation occurs when there's damage. whether that damage was real or whether it was stress. Stress is also a chronic inflammator of the body, where there's no pathogen or there's no UV or there was no inflammation causing agent. Even stress, mental anguish can cause inflammation to increase in the body. You want to avoid the inflammation. You don't want to simply just turn it off. You want to avoid it altogether. Ideally, perhaps if there wasn't a pathogen, maybe you just turning it off would be effective. I can't say. But the best thing is you want to avoid it altogether, the inflammation. But if there was some damage, the inflammation will call the immune system. The immune system will come to the area because it homes in on the inflammation. It will then, they have something called macrophages, and certain aspects of the immune system, they are like the team that handles the repair. They orchestrate it from start to finish. They do the whole wound repair. That's in the inflammation system. They will call the stem cells and they will create the growth factors, and then at the end of the process, they will turn off the inflammation. So there's a real biological system there. So there's a perfect repair strategy. So that's how this whole system works. Damage avoidance, robust repair, processing the inflammation. So that's the argument. Okay. Yes, but not if there are conditions that are just damaging the body internally through those high-level damages. But it's still concerned with avoiding the inflammation to begin with. Histopathologic analysis revealed dysfunctional hair follicles. mtDNA depleter mice also show changes in expression of aging-associated markers, including IGF-1R, Clotho, VEGF, and MRP. S5 mtDNA depleter mice showed that by turning off the mutant POLG1 transgene expression, mitochondrial function, as well as the skin and hair pathology, is reversed to wild type level. To our knowledge, that restoration of mitochondrial functions can reverse the skin and hair pathology is unprecedented. Yes, that's a big claim. They're big claims. Because it is possible to infuse brand new mitochondria and have them translocate into the cell through the veins, through the blood system. So, is the mouse a good model? But, doing both, demonstrating the pathology and reversing it is pretty big. It's pretty unprecedented, definitely. There has been a whole range of health benefits associated with mitochondrial, adding mitochondria, infusing mitochondria in heart disease, in children with heart disease, and there is a way to infuse. You can simply infuse mitochondria. The question is whether that mitochondria remains in a good condition, or whether you have to keep doing it. You have to keep, trying to get the old mitochondria out there and get new mitochondria in. But you can infuse it through the vein. There is blood-borne mitochondria that translocates from cell to cell. apparently they can jump out of the cell and move through the cell and jump into another cell. So you infuse it with the intent that they jump into the cells. But there is possibly a question of whether the immune system will accept them or attack them because of their altered DNA and different DNA. In that case, you might need to actually get mitochondria from a person, fix the DNA. Maybe there's some way to culture these mitochondria and mitogenesis, and then when you get enough of them, you infuse it back into the person, or you try and filter out any blood-borne mitochondria out of the person. So they're in a pulse phase of mitochondrial replacement with new mitochondria, if there is such a health benefit. They've already tried that. There was those 2 studies that added mitochondria to children's hearts, and it showed improvement. This is easy to test in humans. All they have to do is infuse mitochondria into them. One of the arguments is that new DNA that's infused degrades rapidly. I'm not sure about that. But you don't get that new mitochondria staying new. You get that new mitochondria getting old fast, exhibiting these problems fast. I don't know if that's true or not. This is just words on the word on the street. This paper is existence of circulating mitochondria in human and animal peripheral blood. But there's mitochondria cell-to-cell translocation. They can somehow leave the bloodstream and they can go down the superhighway and jump into other cells. So it wouldn't be too hard to test this to upgrade the DNA of a person through the bloodstream. So yeah, it's associated with many diseases. And studies that have these mitochondrial benefits, they're usually very widespread, from improvement to heart function to today we're looking at something unprecedented, which is the reversing wrinkled skin now, and hair loss. Introduction. Mitochondrial dysfunction is associated with many mitochondrial diseases, most of which are the result of dysfunctional mitochondrial oxidative phosphorylation, OXPHOS. Mitochondrial OXPHOS accounts for the generation of most of the cellular adenosine triphosphate ATP in a cell. The OXPHOS function largely depends on the coordinated expression of the proteins encoded by both nuclear and mitochondrial genomes. The human mitochondrial genome encodes for 13 polypeptides of the OXPHOS, and the nuclear genome encodes the remaining more than 85 polypeptides required for the assembly of the OXPHOS system. Mitochondrial DNA depletion impairs OXPHOS. That leads to mtDNA depletion syndromes. And the MDS are a heterogeneous group of disorders characterized by low mtDNA levels in specific tissues in different target organs. mtDNA depletion leads to specific pathological changes. MD5 results from the genetic effects in the nuclear encoded genes that participate in mDNA replication and mitochondrial nucleotide metabolism and nucleotide salvage pathways. mtDNA depletion is also implicated in other human diseases such as mitochondrial disease, cardiovascular diabetes, age-associated neurological disorders, and cancer. Wow, this is a lot of, I'm not checking these references, but there's a lot of references in this. A genetic decline in mitochondrial function has been extensively reported during aging. Yes. Furthermore, mitochondrial dysfunction is known to be a driving force underlying age-related human diseases. A mouse that carries elevated mtDNA mutation is also shown to present signs of premature aging. In addition to mutations in mtDNA, studies also suggest a decrease in mtDNA content and mitochondrial number with age. Notably, there is an age-related mtDNA depletion in a number of tissues. mtDNA depletion is also frequently observed among women with premature ovarian aging. Low mtDNA copy number is linked to frailty, and for multi-ethnic population is a predictor of all-cause mortality. A recent study revealed that humans on average lose about 4 copies of mtDNA every 10 years. This study also identified an association of decrease in mtDNA copy number with age-related physiological parameters. This article's like clickbait. Reversing wrinkled skin. To help define the role of mtDNA depletion in aging and various diseases, we created an inducible mouse expressing in the polymerase domain POLG1 dominant negative mutation that induces depletion of mtDNA in the whole animal. Interestingly, skin wrinkles and visual hair loss were among the earliest and most predominant phenotypic changes observed in these mice. In a previous study, we demonstrate that mtDNA depletion-induced phenotypic changes can be reversed by restoration of mitochondrial function upon repletion of mtDNA. Well, repletions would be the therapy. Results: development of mtDNA depleter mouse. Aspartic acid to alanine amino acid change at the evolutionarily conserved site in the polymerase domain POLG1 at 1135 position. Oh, look, they're giving you the creation and verification of doxyline-inducible mtDNA depleter mice. So they've given you very extensive information to be able to peer review this. Acts as a DNA DM mutation, and acts as a DN mutation, and its expression leads to the decrease in mtDNA content and mitochondrial activity. We develop a TET-inducible POLG1 DM mouse model with a ubiquitously expressed bidirectional promoter to control the expression of both POLG1 DN and green fluorescence protein. POLG1 expressing mouse was created by microinjection of the construct into the one-cell stage egg. C57BL6 mouse. That was created by microinjection of the Petri type by ACFP1D11 35A POLG1. The POLG1 DNA is positive found a male mouse, mouse 1, was bred with the chicken B actin to reverse tetracycline controlled transactivator 3 KHRT TAR3. Female mouse, mouse 2, Jackson Laboratories to obtain the inducible POLG1 DN transgenic animal, mouse 3, figure 1.B. Creation and verification of doxyline-inducible mtDNA depleter mice. Presence of the DM PolG1 RTA and JEP were verified by polymerase chain reaction genotyping. Same article, so it's just what A, B, C, and D. That's 1, that's 2, that's 3. The RTA3 was under control of the ubiquitously expressed cytomegalovirus early enhancer element and cage promoter. The PolG1 DNA transgene was turned on by adding doxycycline, dox, in the food and/or by drinking water when the mice were 8 weeks old. The expression of GFP in PolG1 DNA's transgenic mtDNA depleted animals were also verified by whole body imaging for GFP after dox medication induction. The specificity of dox induction was verified by reverse transcription PSR, RT-PSR for the expression of PolG1 in the presence and absence of dox. Reduced mtDNA oxphos supercomplex and enzymatic activities in mtDNA depleted mice. To further characterize the mtDNA depleted mice, mtDNA content is different tissues such as the skin, heart, lung, brain, and liver. To further characterize the mtDNA depleted mice, mtDNA content in different tissues such as skin and heart, lung, brain, and liver. An MD of mDNA depleted mice was determined. Examined. A significant decrease in mtDNA content in these tissues confirmed the ubiquitous decrease of mtDNA content in mtDNA depleted mice, mRNA expression in mDNA encoded genes. Expression of oxphos proteins and stability of oxphos supercomplexes were severely reduced in the skin of mtDNA depleter mice compared to wild-type littermates. We analyzed enzymatic activities of oxphos complexes of mitochondria of the skin of mtDNA depleter mice. A significant decrease in enzymatic activities of oxphos complexes 1 to 4 further confirmed mitochondrial dysfunction in the mtDNA depleter mice. These observations strongly suggest that ubiquitous expression of D1135A PolG leads to reduction of mtDNA content, oxphos supercomplex stabilities, and enzymatic activities of oxphos complexes in mtDNA depleter mice. mtDNA depleter mice showed inflamed wrinkled skin with the hyperplastic and hyperkeratotic epidermis and alopecia secondary to defective hair loss. The mtDNA depleter mice showed a normal appearance until the dox was administered at the age of 8 weeks. After 2 weeks of dox induction, change in scurf was the first phenotypic symptoms. After 2 more weeks, the dox induction grey hair, reduced hair density, hair loss, alopecia, kyphosis, progeroid head, figure 3A and 4. So he's losing his hair. Slowed movements and lethargy was the next line of phenotypic changes that are essentially reminiscent of phenotypic changes naturally occurring during aging. The decrease in size and weight of mtDNA depleted mice was notable at this stage. No significant change in lean mass to length ratio was observed between wild-type and mtDNA depleted mice. Continuous induction of POLG1DN transgene led to the death of some of these mice due to severe mitochondrial dysfunction. 50% of the total mtDNA depleted mice examined in the experiment died at around 40 days of DOX induction, while the remaining mtDNA depleted mice died within 150 days since initiation of DOX induction. Apparently, children who are born with mitochondrial dysfunction don't live very long. They die within 10 years, mostly die within 3 years. So, the mouse is obviously in bad condition. Empty depleter shows wrinkles, hair loss, 4 to 8 weeks. Additional phenotype changes. This is the mtDNA depleter mice. This is the wild type. Wild type. Yeah, it's pretty rough. All the mtDNA depleted mice that survived at least 30 days after DOX induction showed the development of alopecia, further extending the duration of DOX. Induction leads to a gradual change in the pattern of hair loss in the mtDNA depleted mice. Interestingly, the pattern of hair loss was different in male and female mtDNA depleted mice. While male mice showed dispersed hair loss, females represented time-dependent hair loss patterns and overall more severe hair loss compared to male mice. Sex hormones regulate mitochondrial functions and may be an underlying mechanism for gender-specific difference observed in hair loss pattern in mtDNA depleted mice. Besides hair loss, skin wrinkles were also evident in mtDNA depleted mice. Female mice exhibited more severe wrinkles. Compared to age-matched male mtDNA depleted mice. We did not notice any phenotypic changes in the wild-type control group fed on DOX diet. We did not notice any phenotypic changes in the wild-type control group fed on DOX diet, nor in mtDNA depleted mice without DOX diet, normal diet. We conducted a histopathological evaluation of different tissues of mtDNA depleted mice. Interestingly, no significant histological changes except the reduction in cell size were observed in the brain, liver, myocardium, and lung sections of mtDNA depleted mice after 2 months of DOX induction. Optimal mitochondrial function are required to maintain the cell size. Thus, the reduced cell size might be an indication of mitochondrial dysfunction in these organs. At both phenotypic and histological levels, the skin was the first and most affected organ. There's a difference in the brain. There's a difference in the liver, myocardium. It's just this side looks much healthier, and in the lung. Now the ones with the normal mitochondria just looks like better quality. Examination of hematoxylin and eosin stained sections of the skin from the wild type and mtDNA depleter mice showed striking histological difference in all skin compartments. Figure 6, the skin. Okay, we'll get to that. The skin from wild type animals showed typical morphological and telogen skin, in which epidermis was thin, composed of 1 to 2 layers of keratinocytes. Dermis was free of inflammatory infiltrate, and the vast majority of hair follicles were at telogen stage. In striking contrast, the skin from mtDNA depleter mice had hyperplastic and hyperkeratotic epidermis with 4 to 6 layers of keratinocytes, being reminiscent of pathological human epidermis composed of stratum basal, spinosum, and granulosum, covered by parakeratotic predominantly and compact orthokeratotic scale. The epidermis hyperplasia is further confirmed by increased expression of proliferation marker pCNA, proliferating cell nuclear antigen, in the skin of mtDNA depleter mice. Epidermal hyperplasia is one of the common characteristics of intrinsic aging and is associated with wrinkle formation. Epidermal hyperplasia is one of the common characteristics of extrinsic aging associated with wrinkle formation. The increased thickness of the epidermis was primarily due to acanthosis and increased the thickness of the stratum spinosum and stratum granulosum, normally not present in mice. A considerable hyperkeratosis, including both parakeratosis and orthokeratosis, was evident. The keratinocytic hyperplasia and hyperkeratosis extended into the infundibula of the hair follicles. Infundibula of the hair follicles, of which infundibula were occluded by keratotic plugs. This was also associated with the formation of follicular cysts, infundibula epidermoid type, with some of them ruptured with secondary granulomatous and suppurative inflammation. The majority of the hair follicles showed pathological alterations. Although there was evidence of follicular cycling and increased number of follicles in both telogen and anagen in mtDNA depleter compared to wild-type mice, these follicles were aberrant and did not produce normal hair shafts in mtDNA depleter mice. Instead, follicles contained predominantly keratinocytes debris, with only a few developing hair shafts which were fragmented and malformed. Thus, alopecia was not due to loss of hair follicles or cessation of cycling. Rather, the follicles were dysfunctional and could not produce normal hair shaft and completely lost this capability. Furthermore, abnormal formation of hypertrophic sebaceous glands was noted, which some areas reminiscent of nervous sebaceous in the human skin. To establish a link between the changes in the skin and the mtDNA stress, we analyze skin samples by electron microscopy. Electron microscopic analyses reveal the presence of severely degenerated mitochondria with loss of cristae in the skin of the mtDNA depleted mice. Together, these studies indicate that mtDNA depletion in the whole animal predominantly induces skin wrinkles due to the epidermal hyperplasia and hyperkeratosis and alopecia because of abnormal hair follicle development and loss of ability to produce hair shafts. Skin inflammation in mtDNA depleted mice. Skin wrinkles are a hallmark of both intrinsic and extrinsic aging of the skin. Alterations in mitochondrial genome have been associated with the intrinsic aging of skin. The presence of coarse skin wrinkles with marked acanthosis and inflammatory cells in the dermis of the mtDNA depleted mice presented characteristics akin to the intrinsic aging of skin in human. We examined the skin sections for the presence of inflammatory infiltrate in the skin of mtDNA depleted mice. While control mice showed lack of skin inflammation, the mtDNA depleted mice showed marked mixed dermal inflammatory infiltrate, which were also present to a different degree in epidermal and adnexal structures. The infiltrate was predominantly lymphohistiocytic and contained neutrophils, mast cells, and to some degree eosinophils. In the areas where follicular cysts were ruptured, neutrophilic infiltrate accompanied by the granulomatous reaction was prominent. To better define the nature of inflammatory cells, immunocytochemistry and histochemistry were performed. These confirmed the presence of increased number of inflammatory cells, including mast cells, gem-sustained positive cells, granulocytes, MPO positive cells, macrophages, histiocytes, CD163 positive cells, lymphocytes, B lymphocytes, PAX5 positive cells, and T lymphocytes, CD3 positive cells. Data not shown in the dermis as well as in perifollicular and perioepidermal location of the mtDNA depleted mice. The skin sections of wild-type mice were predominantly negative for MPO, CD3, CD163, and PAX5 staining and showed only occasional mast cells. Florid skin inflammatory responses further support the causative link between mitochondrial dysfunction and inflammation. We observed increased expression of inflammatory genes such as IFNB1, IL-28A, and CCL5 in the skin samples of mtDNA depleted mice compared to the skin samples showed in wild-type mice. Our study revealed increased expression of NFKB and cyclooxygenase 2, a nuclear factor Kb, regulated mediator of inflation in the skin of mtDNA depleted mice compared to the skin from wild-type littermates. These observations suggest inflammation contributes to the skin aging in mtDNA depleted mice. Inflammation contributes to skin aging. Okay. Altered expression of matrix metalloproteinases in the skin of mtDNA depleted mice. Skin wrinkling is associated with a loss of collagen fibers, a tight balance between proteolytical enzymes, matrix metalloproteinases, and their tissue-specific inhibitor metalloproteinase, TIMP1. is essential to maintain the collagen fiber content in the skin. Our study revealed increased expression of MMP2 and MMP9 and decreased expression of TIMP1 in mtDNA depleted mice. Expression of collagen type 1 alpha 1 col1a1, an important gene in the de novo synthesis of collagen of the skin, remained unaltered. This study suggests that skin wrinkling associated markers are dysregulated in mtDNA depleted mice. Altered expression of markers of aging in mtDNA depleted mice. To characterize the association of skin wrinkles and aging at the molecular level, we analyze expression of the markers related to intrinsic aging in the skin of mtDNA depleted mice. Increased expression of molecular markers of intrinsic aging like IGF-1R, VEGF, MRPS5, and decreased expression of clotho suggested towards intrinsic aging of mtDNA depleted mice. Figure 8. These observations suggest that mitochondrial dysfunction induces skin aging. So they're able to induce wrinkled skin. Now, is that the same wrinkled skin as in aging? Could be. Are they able to try this in humans? Not by, not in the same way, but in, infusing DNA, infusing new mitochondria, and taking out old mitochondria and sort of pulsing that as a reversal of wrinkled skin and loss of hair by replication of mtDNA. We conducted rescue experiments to substantiate that the mitochondrial dysfunction was the underlying cause for the alterations in the skin of mtDNA depleted mice. DOX withdrawal restored mtDNA content to normal levels in mtDNA depleted mice. So there was a repair of DNA, mtDNA. There was the induction of typical skin wrinkles and loss of hair in mtDNA depleted mice. After exposure to DOX for 2 months, then after 1 month of withdrawal, the skin wrinkles and the hair loss reverted, and the animals appeared relatively normal when compared to age-matched wild-type mice. So it was reversed once the mtDNA thing stopped. It's like lens, only to whether the wild-type mice were a valid candidate for these results. The histological analysis of the skin. The histopathological analysis of the skin of the phenotype reversed mtDNA repleter analysis showed restoration of normal cutaneous structures. The epidermal hyperplasia, abnormal sebaceous glands, and defects in hair follicle development and hair shaft formation were absent in the mtDNA repleter mice. So it actually fixed up. It actually is degraded, and then it came back, which is an amazing ability. The number of androgen hair follicles reverted to the wild-type levels, and the number of hair follicles intelligent also increased in the mtDNA repleter mice compared with the mtDNA depleter mice. We also observed a significant decrease in the inflammatory infiltrate present in the skin of phenotype reversed animals. The macrophages, granulocytes, and B lymphocytes and T lymphocyte that were present in the skin of mtDNA depleted mice were predominantly absent in the skin of the mtDNA replitomyce data not shown. We observed a reversal of mtDNA content and the expression of mtDNA encoded genes. Expression of genes in the skin inflammation and wrinkling were also reverted to the levels of wild type animals. The observation suggests that mitochondrial dysfunction, including phenotypical, histopathological, and molecular changes, can be reversed by restoration of mitochondrial function. Now they would know what the macrocytes, the lymphocytes, the T lymphocytes, the granulocytes were present in that area because there was a problem, there was a damage occurring or something, inflammation. Yeah, that's devastating. Discussion. Accumulating evidence suggests a strong link between mitochondrial dysfunction, mitochondrial diseases, aging, and aging-associated diseases. Notably, increased somatic mtDNA mutations and decline in mitochondrial functions have been extensively reported during human aging. Studies also suggest a decrease in mtDNA content and mitochondrial number with age. The major finding of our study is that the ubiquitous depletion of mtDNA predominantly leads to wrinkled skin and hair loss, accompanied by inflammatory phenotype. Wrinkled skin and hair loss are obvious features of skin aging and aging-associated phenotypical changes in humans. We discovered that these aging-associated phenotypic changes could be reversed by restoring mtDNA content to the wild-type level. To our knowledge, this observation is unprecedented. Yeah, I've never seen a paper where it's just so black and white like that. Skin wrinkles are a hallmark of both intrinsic and extrinsic aging of the skin in humans. Mitochondrial dysfunction is implicated in both intrinsic and extrinsic aging. The presence of skin wrinkles, acanthosis, epidermal hyperplasia, and hyperkeratosis, and marked inflammatory infiltrate in the skin of mtDNA depleted mice represent characteristics similar to the intrinsic aging of skin in humans. Furthermore, the changes in expression of intrinsic aging associated genetic markers support intrinsic mechanism underlying these phenotypic changes in mtDNA depleted mice. In support of our studies, a link between accumulation of mtDNA mutation and aging specific in mouse have been identified previously. Loss of collagen fibers is reported to underlie skin wrinkles. A tight balance between the proteolytical enzymes, MMPs, and their tissue-specific inhibitor, TIMP1, is essential to maintain the collagen fiber content in the skin. Expression of MMPs is altered in the aged skin. Consistent with these reports, the skin of mtDNA depleted mice showed increased expression of MMPs and decreased expression of TIMP1, indicating a loss of balance contributing to the development of skin wrinkles. Repletion of mtDNA content restored MMP expression, leading to a reversal of wrinkles, leading to a reversal of wrinkled skin, leading to a reversal of wrinkled skin and hair loss. These experiments show that mitochondria and regulators of skin aging and hair loss. These experiments show that mitochondria are regulators of skin aging and hair loss. This observation is surprising and suggests that epigenetic mechanism underlying mitochondria to the nucleus crosstalk must play an important role in the restoration of normal skin and hair phenotype. Further experiments are required to determine whether phenotypic changes in other organs can also be observed in wild-type level by restoration of mtDNA. mtDNA stress triggers inflammatory response. Inflammation also underlies aging as an age-related disease. Increased levels of markers of inflammation in our study indicates an activated immune response in the skin of mtDNA depleted mice. Increased expression of NF-κB, a master regulator of the inflammatory response upon mtDNA depletion, and its reduced expression after the restoration of mtDNA content suggests that NF-κB signaling is a critical mechanism contributing to the skin and hair follicle pathologies in mtDNA depleted mice. Indeed, NF-κB signaling was described as a well-known regulator of tissue homeostasis previously. Furthermore, a unique feature of protein encoded by mtDNA, N-formal methionine, and the N-terminus N-formulated peptides were present in the extracellular space, are known to act as mitochondrial damage-associated molecular patterns and activate neutrophils or activate keratinocytes, intrinsic responses resulting in the recruitment of immune cells. Well, these are big statements. I don't know why we've never heard this before. A recent study also supports our finding, which shows that expression of mutant mitochondrial helicase K32E twinkle in the mouse epidermis induces inflammation in the skin. Despite these similarities at the skin level of skin inflammation between our results and this report, and we notice the difference. Well, isn't lifespan attributed to the mother's mitochondria? Thus, our studies indicate an important role in mitochondria in the skin when compared to other tissues. Secondly, our studies demonstrate that reversal of inflammatory gene expression strongly suggests a role in epidermis or in the regulation of these genes. Lastly, we demonstrate clearance of infiltrated immune cells from dermis upon restoration of mitochondrial function instead of otherwise massive immune cell presence in the skin of mutants, twinkle mouse. Also, the short lifespan of K32E twinkle mice prevented any aging study. However, we show the development of wrinkles and loss of hair, a persistent and profound feature of human aging. Similarly, epidermis-specific TFAM knockout mouse shows defects in epidermal differentiation, hair follicle morphogenesis during embryonic development. However, due to the short life of TFAM knockout mice, these studies did not observe the effect of mitochondrial dysfunction, leading to skin wrinkles and hair loss in mice. In summary, development of mtDNA depleter mouse revealed that the loss of mtDNA homeostasis is responsible for the development of skin wrinkles, epidermal hyperplasia, inflammatory phenotype, and loss of hair due to abnormal development of adnexal structures. This mouse allowed the ubiquitous suppression and restoration of mitochondrial function in the whole animal. The mtDNA depleter mouse can help rapidly identify genes in pathways that can help in molecular understanding, leading to amelioration of mtDNA diseases. Furthermore, this animal model holds promise to generate tissue-specific modulation of mitochondrial functions to determine for various organs the effects of mitochondria on in vivo aging and pathogenesis and MD5 and other mitochondrial diseases. Together, this mouse model should provide an unprecedented opportunity for the development and preventative and therapeutic drug development strategies to augment the mitochondrial function for the treatment of aging-associated skin and hair pathology and other human diseases in which mitochondrial dysfunction plays a significant role. Materials and methods. The creation of mtDNA mice. This has too many acronyms in it. It's not readable. But if you want to peer review this, you create these mtDNA depleter mice. But there's just so much information on mitochondrial and people who have mitochondrial disease and how it's so deleterious to their health. So if somebody could put together if somebody were to put together, a whole thing of mitochondria disease, they would learn that that was reversing wrinkle, skin, and hair loss in mice by restoring mitochondrial function. It's pretty amazing how we keep seeing, it's an amazing article, the results that they received and the way they reversed it when they stopped it. Are those mice significant of mitochondrial dysfunction? But there are so many humans with mitochondrial diseases, and they're all humans with mitochondrial diseases, and many of them, it's delirious to the health. It certainly is. There is ways to get new mitochondria into people. Yeah, the lifespan was relative to the mother's side, lifespan relative to the mother's side, because the mother has the mitochondria, which is a big indicator. So, who knows, supercharging the mitochondria, sending in some nanobots to replace the mitochondria, sending in some cultured mitochondria that is person specific, so it passes the immune system, and trying to service the mitochondria like an oil change, like we had that oil change thing with the blood people. Do we service the mitochondria as well? Try and extract it and try and put new mitochondria in, because of the ones that go in the blood, take them all out and put some new ones with very good DNA in them, and just keep pulsing that with the having that do that every month. Okay, Immortality IMT, cryptocurrency for the longevity field. Now we're an emerging field, and we've got some pretty good information. I think we're going to have a field on our hands, and when we have this field on our hands, this is going to be dynamite. But it ain't going to be for everybody. It's going to be for the richest and the wealthiest and those that can most afford it. So, time to get in early. Head on down to the website, buy some Immortality, cryptocurrency for the longevity field, so you can have access to some of these therapies. Okay, thank you. Bye-bye.